West Nile virus infection is a mosquito-transmitted virus that leads to inflammation of the brain or encephalitis. When assessing a patient with West Nile virus, initial manifestations are fever, headache, fatigue, vomiting, diarrhea, and skin rashes. Late signs and symptoms will include severe headache, stiff neck, high fever, confusion, stupor, tremors, coma, and paralysis. The incubation period for a client with West Nile virus infection is between 2 to 14 days. What are the different diagnostic procedures that can help the patient? 1. Blood test to identify infections in the blood. 2. Spinal tap to identify the extent of infection that will affect the central nervous system. 3. Electroencephalogram or EEG to identify the abnormal electrical impulses in the brain. And lastly, MRI or magnetic resonance imaging to identify the extent of damage into the brain. Can we prevent West Nile virus? This disease can be prevented by unclogging roof gutters, changing water in birth baths and pet bowls regularly, installing and repairing screens on windows and doors, wearing long-sleeved shirts and long pants when outdoors. What are common treatments we use for the client to recover much faster? Intravenous fluid is expected to be given to prevent dehydration and prevent electrolyte imbalances. Over-the-counter pain medications may be used, such as acetaminophen. Interferon will help to reduce the signs and symptoms, and we implement standard precaution. Let's try to find out whether we've learned from this topic. Let's have a sample question. Which of the following are true about West Nile virus? Select all that apply. 1. It is caused by a mosquito bite. Yes. 2. It leads to brain inflammation or encephalitis. Yes. 3. Initially manifested with fever, headache, and fatigue. Yes. 4. Incubation period is between 2 to 14 days. Yes. 5. Prevention may include unclogging roof gutters. Yes. 6. Interferon is used to decrease the signs and symptoms of West Nile virus. Yes.